Innovation, opportunity, and caring for Manitobans. These are just some of what makes Diagnostic Services Manitoba so great. As the provincial leader in medical laboratory and medical imaging services, science and medical technology are the backbone of what we do, but people are definitely the heart, especially the patients we serve. You may have even visited one of our facilities as a patient, whether to have some blood work done or perhaps an X-ray, and hardly even realized it was DSM. That's because DSM is seamlessly integrated into Manitoba's healthcare system, so our physicians, scientists, and technical professionals can work collaboratively alongside frontline healthcare professionals. And this helps us to create patient-first environments because Manitobans can have their diagnostic work done quickly and efficiently no matter where the patient lives. DSM has over 70 locations across Manitoba, from Churchill in the north to Emerson in the south, and so many places in between. This large network of facilities also makes us the largest employer of diagnostic professionals in the province. We have over 1,600 lab, imaging, medical, scientific, and support staff working to provide results that are vital for proper diagnosis and treatment of so many patient concerns and conditions. Because DSM is located in hospitals and health centers and sites, it can be hard to differentiate DSM from its healthcare partners. Staff often identify with the RHA facility in which they work, as well as with DSM. We see this dual identification as a collaborative strength. Because diagnostics are such a critical function within healthcare, you'll often hear us use the phrase, results that matter. For the patient, results are often the turning point between a health concern or issue and treatment. In fact, more than 75% of treatment decisions are based on the results of diagnostic testing. That means that doctors are relying on DSM so they can diagnose patients, monitor conditions, and prevent and cure many illnesses, diseases, and disorders. With that in mind, DSM adheres to the highest standards and quality at all times. Our facilities are accredited by either the Manitoba Quality Assurance Program or the College of American Pathologists. But accreditation is not just a privilege conferred on us. It is something we work diligently to uphold to ensure the safety of our patients and the accuracy of our results. To this end, DSM has its own quality department that manages all our accreditation activities and ensures we are maintaining the standards required for accreditation. We're proud that inspectors have been impressed with our quality improvement activities, documentation, and our staff's dedication in working toward compliance. If quality is a DSM cornerstone, another would be innovation. In working toward our vision of supporting the healthcare needs of all Manitobans, we are constantly evolving and searching out new ways to improve speed, processes, and service for Manitobans. Nowhere is this more apparent than in the role we play in cancer diagnosis, where we look for ways to reduce the time Manitobans spend wondering whether or not they have cancer and to speed up physicians' ability to begin cancer treatment. Innovation also creates a leading-edge work environment for our employees. When you work for DSM, you can expect to see proven technology and current medical research at work. This means DSM is also committed to continuing professional development for our employees, to promoting advancement within the organization, and to providing new challenges and opportunities for staff to grow and learn within and even beyond their discipline. DSM employs people from across several disciplines that are all equally important to the role DSM plays in healthcare. Each discipline area is led by a team that provides expertise in all of our testing areas, guiding service delivery based on best practices, research, and emerging trends and technology. Depending on your background, you may have a good idea of what these disciplines look like. But if you don't, here's a quick look at all 7 disciplines. In biochemistry and genetics, DSM analyzes chemical and hormonal changes in the body and studies chromosome, DNA, and RNA. Both of these areas help to detect problems that contribute to illness, genetic disease, and death. The clinical microbiology discipline detects and identifies diseases caused by microorganisms like bacteria, fungi, and parasites that can cause serious illness and conditions. The DSM hematology team provides testing for anemias, leukemias, and blood disorders by examining blood cells and bone marrow. Immunology looks at the structures and functioning of patients' immune systems, helping to detect a wide variety of diseases, allergies, and disorders. Transfusion medicine is the discipline area responsible for the production of blood products and examining compatibility between donors and recipients. Our pathology team studies tissues and fluids removed from patients for the purpose of detecting cancer, other major diseases, and causes of death. The diagnostic imaging discipline works with X-ray, mammography, CT, MRI, and ultrasound to perform different procedures that provide detailed images and information about different structures and organs within the body. More information on the roles and responsibilities of our discipline teams is available on the DSM intranet. As distinct and separate as these discipline areas appear to be, DSM looks at them as parts of an interprofessional healthcare team that work together to holistically examine, diagnose, and care for Manitobans' health. Our staff in one discipline may collaborate alongside staff in another discipline, as well as with physicians, nurses, and other members of a patient's healthcare team. And we've learned firsthand that staff can learn a great deal from one another across all of these disciplines. DSM's disciplines are represented at sites across Manitoba. Of course, not every discipline is at every site, but Manitobans don't have to look far to find them. This means that a key priority for DSM is to make sure the facilities are staffed with the right people. While big urban laboratories and facilities provide an environment where you can focus and hone skills in a very specific area, rural settings offer opportunities to learn new skills and cross-train in different procedures. Often, rural settings permit the greatest career diversification. But because DSM is a single entity across the province, you can carry your seniority and benefits with you no matter where you go. Think of the possibilities of working rurally. You can ski at Assisipi, or go fishing at some of the most pristine lakes in the north, or personally experience other amazing recreational opportunities that only rural life can provide. DSM has also established strong partnerships with relevant educational institutions in Manitoba. Not only do we provide funding for research initiatives, but we provide a live training ground for students who are completing their degree or relevant program, including medical residents in local hospitals, as well as students who will eventually work in diagnostics for DSM or elsewhere. Students who are sited in a DSM facility as part of their training receive top-notch opportunities to apply their learning in real-life situations, mentorship by experienced and knowledgeable professionals, and opportunities to learn beyond the scope of the classroom. Along with offering competitive salaries and a comprehensive benefits package, including the Northern Living Allowance for appropriate staff, DSM promotes a diverse, professional, and relevant work culture through various programs and policies. For instance, we take workplace safety and health very seriously. DSM's Environmental and Safety Officer is your resource for health and safety issues in the workplace. Whether issues are related to safety risks, physical hazards, or workplace injuries, general wellness, or physical strains and ergonomic concerns, DSM is committed to equipping you with the knowledge and resources to work safely every day. But it's important to remember that safety is everyone's responsibility, so you also have a responsibility to work safely and report hazards or concerns. When considering safety, it's important to mention DSM's dress code. The dress code ensures people inside a DSM facility are dressed in a manner that is safe and reasonable for that working environment. For instance, closed-toe shoes and lab coats are required in all working labs and imaging areas. In some places, you may have to also wear safety glasses. There will also be many occasions where you will have to wear gloves or other personal protective equipment when handling specimens. When in doubt about what to wear, please ask your trainer or supervisor for further direction. Equally important to safety is DSM's Respectful Workplace Policy. This means that all people in a DSM facility, whether they are staff, contractors, board members, medical residents, students, or volunteers, are entitled to an environment completely free of disrespectful behavior. This includes any kind of discrimination, harassment, sexual harassment, disruptive workplace conflict, personal harassment, and workplace violence. All DSM policies, workplace safety and health, respectful workplace, the dress code, and others, like routine practices, are designed to ensure a comfortable, safe, and respectful workplace for everyone, including employees, partners, and patients. It is important for you to become familiar with all of them and to ensure you are practicing them. More detail on all policies is available on the DSM intranet, the DSM Policy Handbook, or by talking to your supervisor or trainer. When you are working for DSM, as an employee or as part of your training, you are expected to uphold our corporate values. We are committed to patient-centered care and the provision of innovative and collaborative diagnostic services with integrity and accountability. Remember, as a member of the DSM team, you are providing results that matter. So work accordingly and be proud of what you do.